Hello, classmates and Professor Grant. My name is Chris Hawkins. I am a college junior and I hold an Associates of Science degree in Human Services. My current course of study is in addiction counseling. And today's presentation is about understanding cybersex and compulsivity. In today's digital age, technologies become integral to our lives, bringing opportunities and challenges. And one challenge I chose to explore is this rising issue of cybersex addiction and compulsion. I chose this because, again, we're living in a world, technology's everywhere. It's how we connect, entertain, and explore. With these changes come new problems. One of them is the increasing concern about online sexual behavior. So we're here to dive into this issue, and we'll go from definitions to treatments. What is cybersex? Cybersex refers to sexual interaction and communication taking place over the internet or some type of digital device. It involves one individual or several engaging in sexual conversations, exchanging messages, images, videos, or participating in sexual activities using electronic means. Cybersex can occur in various forms, such as text, video, online, or through social media. And it can also be consensual or non-consensual. And it's distinct from physical activity, sexual activity, because it primarily occurs in the virtual environment. What is compulsivity? Compulsivity refers to a behavior that is repetitive, often irresistible, and even if it has negative consequences. People with compulsive behaviors feel driven to perform these actions, and they may struggle to control or resist them despite negative outcomes. It's important to note that compulsive behaviors can vary widely. And they typically share the characteristics of repetitive, excessive, and difficulty to control. Is cybersex a compulsion or an addiction? We tackled this in class. And while there is a growing understanding of internet/porn/sex addiction, within the context of neurobiology, there's not a consensus yet as to whether this should be a formal diagnosis or not. The difference is that a compulsion is an insatiable urge to do something to reduce fear and anxiety, so to take away, whereas an addiction is a need to do something to experience pleasure or remove discomfort, so for a positive. So one is an urge, and one is a need. As far as the prevalence, I used a study where there were 2,000 men and women asked about their sexual behavior online. And it turns out that 8.6% of users report distress and impairment associated with difficulty controlling their feelings, urges, and behaviors sexually. And with the U.S. internet usage at almost 93.4%, this would lead to an estimated 26 million people that have behavioral concerns about their sexual behavior online. It is also 3 times more prevalent in men. There are multiple assessments, both online and in person, both for the professional and for the individual. Turns out that a lot, 70 to almost 100% of individuals struggling with paraphilic or sexually compulsive behavior also have a comorbid Axis 1 condition, commonly personality or obsessive compulsive. So the focus of the non-internet assessment is to figure out which other disorders the person may have. As far as the global internet assessment, this is how to determine the types of the individual's online behavior, sexual behavior, the frequency of the behavior, and the impact of the behavior on their lives. This is done by a professional in person, and it's important to remember that not all cyber sex behavior is unhealthy or problematic. And lastly, an internet sex screening test that's self-administered, and this can help individuals actually assess their own cyber sex behavior, positive or negative. It's a short screening test to give both the professional and the individual basic data on whether the client should be further assessed for problems. There are many co-occurring issues that arise with cybersex or porn addiction. Turns out 65 to 85% of individuals struggling with sexual compulsion also present comorbidly with other disorders. And these disorders are most common anxiety and general mood disorders, including depression, anxiety, bipolar disorders, obsessive compulsive disorders, addictive disorders, and attentional issues such as ADHD. Treatments. There are multi-pronged treatments, and most often the best treatment typically involves a combination of psychological, behavioral, and lifestyle interventions. So a therapy, we would first use cognitive behavioral therapy. And as we've learned, this helps changes the addiction-related thoughts and behaviors by understanding the triggers and teaching coping skills. Mindfulness and meditation. These are techniques that increase the awareness of the cravings that come on without judgment, and it helps individuals to control their impulses. Support groups, such as Sex Addictions Anonymous, SSAA, they create a supportive community. Individuals can share their experiences and strategies for recovery, often encouragement and accountability. And then also there's the method of filtering and monitoring software. And these tools can block explicit content and monitor the internet use to make it harder to access porn and increase awareness of your online habits. The relation to what we do as human services professionals and its relation to substance abuse. Human services encompasses support and assistance for individuals in various domains, including mental health and addiction. So cybersex and compulsivity issues often have underlying emotional and psychological components, as we just discussed. Cybersex and compulsivity co-occurs with substance abuse, and they typically exacerbate one another. So addressing both issues simultaneously is critical for effective treatment and recovery. Cybersex and compulsivity can lead to isolation, emotional distress, and negative consequences in personal relationships. And the coexistence of substance abuse can dramatically complicate treatment strategies and requires a holistic approach. And finally, human services professionals play a crucial role in identifying and supporting individuals struggling with cybersex compulsivity as well as substance abuse. In conclusion, this presentation has explored the world of cybersex and compulsivity, diving into definitions, the impact on human services and substance abuse, prevalence, and the debate surrounding their classification as either addiction or compulsion. We've also discussed different assessment tools, co-occurring issues, as well as treatments. These issues are increasingly relevant in our digitally connected world. Clearly, researchers and practitioners need to keep up with the evolving landscape of technology and its impact on sexual behavior. So by understanding the nuances of cybersex and compulsivity and staying open to new research, we can better assist individuals with dealing with these challenges. offering treatments and supporting their well-being and overall quality of life. In human services, understanding these issues is vital. They often intertwine with broader concerns such as mental health, relationships, and well-being. And this knowledge we view today will help equip us to provide more effective support to individuals and communities. Thank you for listening. You will find here local and national resources that will assist in cybersex or online porn addiction. And lastly are the references that I used. Again, thank you for listening.